Hey everyone, hope you're having a great day. You're listening to the RX Daily Dose. Today's episode is being recorded for Monday, June 28th, and I'm your host, Ian Parnagoni. We update this podcast for healthcare providers, medical professionals, and anyone who has an interest in drug updates. Don't forget to like, share, and subscribe on all your favorite podcast platforms and social media, including iTunes, Spotify, YouTube, and Instagram. All links can be found in the show notes below. So in today's episode, we have two expanded indications. First is Ultomiris, which is now approved for pediatric patients with paroxysmal nocturnal hemoglobinuria, and approval of Pradaxa for pediatric patients with venous thromboembolism. And we also have a product that is moving from prescription to OTC, that's Astepro for seasonal and allergic rhinitis. As always, feel free to skip around. I'm going to include times in the show notes so you get the drugs that interest you. First up this week, the FDA has approved ravulizumab, which goes by brand name Ultomiris, an injection to treat patients aged 1 month and older with paroxysmal nocturnal hemoglobinuria, a rare, life-threatening blood disease. Paroxysmal nocturnal hemoglobinuria, commonly referred to as PNH, is categorized by red blood cell destruction, anemia, blood clots, and impaired bone marrow function. The disease affects 1 to 1.5 people per million, and approximately 10% of cases are among pediatric patients. PNH can be serious, with median survival of 10 years after diagnosis. However, some patients live for decades with only minor symptoms. PNH is caused by gene mutations that affect red blood cells. Red blood cells in people with these mutations are defective and can be destroyed by the immune system, which causes anemia. Ultomiris is a monoclonal antibody and is a terminal complement inhibitor drug that specifically binds to the C5 protein of the terminal complement cascade and inhibits its breakdown. The drug prevents the destruction of terminal complement-mediated red blood cells in patients with PNH. The effectiveness of Ultomiris was evaluated in a 26-week study enrolling 13 pediatric patients aged 9 through 17 years with PNH. 5 of the 13 patients had never been treated with complement inhibitors, and 8 patients had been treated with Solaris, another PNH therapy. Patients received a first dose of Ultomiris and a maintenance treatment after 15 days. Then patients weighing 20 kilograms or more received treatment every 8 weeks, while patients weighing less than 20 kilograms received treatment every 4 weeks. The primary endpoints for this study were pharmacokinetic and pharmacodynamic parameters. There were several secondary endpoints, including avoiding blood transfusions. After the 26-week study, 60% of patients who had not previously received complement inhibitors avoided a transfusion, and all patients who had received prior Solaris treatment avoided a transfusion. Ultomiris is available only through a restricted program under a risk evaluation and mitigation strategy. Meningococcal infection and sepsis can occur in patients taking Ultomiris and can become life-threatening or fatal if not recognized and treated early. Patients with unresolved Neisseria meningitis infection or who are not vaccinated against this infection should not take Ultomiris unless the risk of delaying treatment outweigh the risk of developing a meningococcal infection. Other infections can occur as well, and patients should be monitored for infusion-related reactions. The effect of withdrawal of anticoagulant therapy during Ultomiris treatment has not been established. The most common side effects of Ultomiris for patients with PNH are upper respiratory tract infection and headache. Ultomiris received priority review and orphan drug designation for the pediatric PNH indication. It was originally approved in 2018 and is also indicated to treat adults with PNH and adult and pediatric patients with atypical hemolytic uremic syndrome. Also this week, the FDA approved dabigatran etexylate, which goes by brand name Pradaxa, as oral pellets to treat children 3 months to less than 12 years old with venous thromboembolism directly after they have been treated with a blood thinner given by injection for at least 5 days. The FDA also approved Pradaxa oral pellets to prevent recurrent blood clots among patients 3 months to less than 12 years who completed treatment for their first venous thromboembolism. In addition, Pradaxa was approved in capsule form to treat blood clots in patients 8 years and older with venous thromboembolism directly after they have been treated with a blood thinner given by injection for at least 5 days, and to prevent recurrent blood clots in patients 8 years and older who completed treatment for their first venous thromboembolism. Pradaxa is the first FDA-approved blood thinning medication that children can take by mouth. The only other approved blood thinning medication for children is given by injection. Pradaxa was originally approved in 2010 to reduce the risk of stroke and systemic embolism in adult patients with non-valvular atrial fibrillation. Blood clots can be a serious problem in children as well as adults. Children are most at risk for blood clots if they have cancer, congenital heart disease, a central venous catheter, or are admitted to an ICU. Venous thromboembolism can lead to complications including swelling and discomfort near the clot, chest pain, lung damage, and even death. Pradaxa works by reversibly binding to the active site on the thrombin molecule, preventing thrombin-mediated activation of coagulation factors. This prevention results in decreased formation of fibrin and reduces thrombin-stimulated platelet aggregation. All this results in preventing the formation of blood clots. The safety and efficacy of Pradaxa for treating blood clots in patients younger than 18 was evaluated in one study of 267 pediatric patients. In this open-label study, patients were randomly assigned to receive either Pradaxa or standard of care. The study compared the two groups for the number of patients who met the composite endpoint, which meant that they had not died from a blood clot, their blood clots had completely resolved, or they had no additional blood clots. Results showed that 45.8% of people taking Pradaxa met the composite endpoint, compared to 42.2% of patients who received standard of care. The safety of Pradaxa to prevent recurrent blood clots in the same pediatric population was evaluated in an open-label, single-arm study in 214 patients with a history of blood clots. The primary endpoints of the study were recurrence of blood clots, major and minor bleeding events, and death. The safety of Pradaxa with long-term use was similar to the previously discussed study. Recurrence of blood clots occurred in 3 patients, which was comparable to prior standard of care treatments. The most common side effects of Pradaxa include digestive system symptoms and bleeding. Pradaxa can cause serious and fatal bleeding, and is not recommended for patients with bioprosthetic heart valves or triple-positive antiphospholipid syndrome. Pradaxa has a boxed warning cautioning that early treatment discontinuation may increase the risk of blood clots, and that blood accumulation within parts of the spinal cord in patients undergoing spinal procedures may cause serious side effects. Pradaxa received a priority review designation for this indication. And finally this week, the FDA approved a nasal antihistamine for non-prescription use through a process called a partial prescription to non-prescription switch. The FDA approved azalastin 0.15% nasal spray, which goes by brand name Astepro, for seasonal and perennial allergic rhinitis, commonly known as allergies, for adults and children 6 years of age and older. For a drug to switch from prescription to non-prescription status, the data provided must demonstrate that the drug is safe and effective for use in self-medication as directed in proposed labeling. The manufacturer must show that consumers can understand how to use the drug safely and effectively without the supervision of a healthcare professional. This approval is a first-in-class switch for a nasal antihistamine and is considered a partial switch because the 0.1% strength, which includes the perennial allergy indication for children 6 months to 6 years old and seasonal allergy indication for children 2 to 6 years old, will remain prescription-based. Astepro can cause drowsiness. The label warns that consumers using this product should avoid alcoholic drinks and be careful when driving a motor vehicle or operating machinery. Using Astepro nasal spray with alcohol, sedatives, or tranquilizers may increase drowsiness. And that's all I have for right now. I hope you enjoyed today's episode. I'll include all links in the show notes below, so please go back and check those out too. Please connect with me on any of your social media platforms and give me feedback on what you heard today. I'd love to know what you thought about the episode. And as always, feel free to like, share, and subscribe wherever you listen to your podcasts. And thank you so much for tuning in. Stay safe out there, and I hope you enjoy the rest of your day.